Hi, this is Judd Mellinger-Blount, Director of the Pennsylvania Primary Care Career Center, and we're here for another installment in our interview series with physicians and other clinicians from community health centers. Today, I am joined by Dr. Bolanle Limann, the Chief Medical Officer at Hamilton Health Center, which is the federally qualified health center in the capital city of Harrisburg. And so it's nice to have Dr. Limann here. She is a graduate of Cornell University and also New York Medical College, did her residency at Johns Hopkins, her internal medicine residency at Johns Hopkins, also has a master's in public health and a master's in business administration from Johns Hopkins. So she's quite the Hopkins person. And Dr. Limann, it's great to have you here today.
Pleasure to join you, Judd.
Thank you. And I also forgot to mention that Dr. Limann lives in Mechanicsburg, with her husband and 3 kids. How old are your kids? I didn't ask you that before.
12 going on 15, 11, and 6.
Okay, very good. Yeah, those 12-year-olds tend to go on 15, don't they?
Yeah.
Very good. So, Dr. Limann, tell us a little bit about your background, where you grew up, any kind of family influences on your career, anything you want to share in that regard.
So my father, he's deceased. He was originally from Nigeria, West Africa. My mother is from upstate New York. So I spent my formative years in Italy and in Nigeria and was blessed to have the opportunity to spend my summers with my extended maternal family in upstate New York and in the UK. Regarding your question with influences and how I am here today, I think there are 2 main sources. I went to one of the best all-girls schools in Nigeria called Queen's College, and it was a very competitive school, but in a positive way. So I think it was collegial, aspiring, very motivating group of colleagues that really encouraged me, to study, many of whom are friends until today. I often tell a story of, so in not all West African countries, but in Nigeria, there hasn't been consistent electricity for decades. So I remember a senior year of, or junior year of high school, I would wake up early in the morning to study, and my mom said there was no electricity. So I asked her to turn on the generator, and she said, "You've been studying too much." And I said, "No, I have to study." And so there I was with a flashlight, studying in high school. So, I think I owe a lot to my colleagues and to the high school I went to. My father and my brother are physicians, and I think that growing up in that environment and seeing the passion that my father had and the changes that he made were definitely inspiring. I will make note, my father was actually just in the December 2020 British Medical Journal as one of the pioneers of mental health. He was actually the second indigenous psychiatrist in Nigeria, which is the most populous country in Africa. So I actually spent some of my formative years living on an inpatient psychiatric institution. So definitely seeing the change that he made in other people's lives also was an inspiration.
That's quite an interesting background compared to your run-of-the-mill, if there is such a thing as a run-of-the-mill American physician. So talk a little bit about what kind of barriers you think you had to overcome, and conversely, what kind of benefits. I mean, having a physician as a father can, I've seen that work both ways. Working with doctors for a long time, like I have, sometimes people don't want to follow in those footsteps. And what kind of barriers do you feel like you had to overcome, in any regard, with becoming a physician?
So I will say, so I left Nigeria and came here as a senior in high school. So definitely my parents served as, mentors and great role models. But I came here back, in that time it cost, I don't know, $1.50, $2 to call home for a minute. So I was here somewhat independently for college. And so I think one of the barriers was strong mentorship. Many people think of medicine as, a one-way pathway and having to take X amount of classes and pre-med classes and this and that. And I think that I didn't, one of the barriers was finding the mentorship to nurture me in my interests. And my interests were very different than many other pre-med students. I always had an interest in public health and nutrition, and international public health, and that isn't quite, similar to many of the people around me. I think cost is an issue, was, it is today. I mean, I was very blessed to get a scholarship through the National Medical Fellowship, but I'm, now get routine emails from them, and that people with $250,000 in debt. So that definitely is a barrier. And then obviously just being very, very competitive. I think that that's somewhat of a deterrent to some.
Right, right. So your career path did not immediately take you into the community healthcare setting. What caused you to consider working at Hamilton Health Center? And do you consider this a career change or simply like the next step in your career?
So that's a good question. So not a career change at all. So my first degree was in nutritional sciences at Cornell, and I had a very strong interest in public health at the time. So I've always had very interest in healthcare disparities, nutrition. And so what I didn't realize is that I could drive only 15 miles away from my house to find that. So during undergrad, med school, I would say really until I joined the Health Services Committee at Hamilton, I always thought that we had to leave, or I had to leave the US to find that. I did a bunch of electives, actually ranging right from undergrad, in Nicaragua, Kenya, Bangladesh, India. And it wasn't until I was on the Health Services Committee at Hamilton that I realized it was right across the river, which, in some ways is wonderful that I don't have to go far. And in other ways, it's very unfortunate that we live in the United States and there are people that do not have access to basic healthcare or are unaware of their access to basic healthcare right from birth.
Right. Right. And for those of you who aren't familiar with the Harrisburg area, when Dr. Limann says the river, it's the Susquehanna River, which divides what we call here the East Shore and the West Shore. And they really are two very different worlds in some regards, with the West Shore where you live in Mechanicsburg being a lot more, supposedly a lot more affluent, although there's low-income folks everywhere. So how do you think your personal philosophy, talk a little bit about that, how that has led to this point in your career?
I think one is to always strive to be my best. And not comparing myself to others. I think, like I mentioned, as a pre-med student and also during residency training, I had to really focus on what I was interested in. So for example, Johns Hopkins is an academic center. Many of my colleagues were interested in clinical research, and I had to stand firm and not do things that I was not interested in. I was interested in public health. I was also interested in business. And so, while my colleagues, found mentors, research during their extra time, I luckily was allowed to take MBA classes at night during residency. We had to give a presentation during our senior year. Many people pertain to clinical studies. Mine was on the cost savings and efficiency for patients to be directly admitted from clinic to the hospital as opposed to going to the ED. So being able to just stay focused, striving to do my best, but not comparing myself to others and trying to find my own, unique pathway, I think was one. I think the next thing is always seeking to improve your skills, seeking to remain intellectually stimulated. My interests are always growing. I don't know what I'm going to be interested in next. Last year, I found a grant. I took a grant writing class through Temple at some point a few years ago. I was interested in real estate, so just staying stimulated. It's not necessarily just at work, but obviously that work-life balance and things outside work are imperative.
Right. And I've heard many a primary care physician tell me that they were dissuaded from going into primary care because it wasn't intellectually stimulating enough. But you've got to find it where you can. So
Yeah, and I'm not so sure about that. I think that's based on the competitiveness to get into fellowships, and because certain fellowships and specialties pay more than internal medicine. But at the end of the day, we are the ones who see the cases first. So I don't think it's ever boring. I mean, let's use this pandemic and the way people are presenting with different symptoms. It is not the anesthesiologist, interventional cardiologist that determines, you know, the first step. Is primary care providers that do that.
Right. Yeah, I don't mean to say that I agree with what those people were saying, because I disagree very much. Is there anything, I know when I started, I've been in healthcare a while, and when I started working for Pennsylvania Association of Community Health Centers, I found out how little I knew about community health centers and what they did, even after all these years in healthcare. Is there anything that surprised you about working at Hamilton? Or is it exactly like you thought it was going to be?
So, like I said, I think I was surprised at the disparities and the extent of the disparities. I think that's one thing that surprised me. I think the diversity actually surprised me as well. I mean, I really did not. Let's use yesterday, for example. I had 4 Nepalese patients. I had 1 Arabic patient who, by the way, when I used the Syricom, it wasn't the Arabic that it goes to, is Egyptian Arabic that was required, you know, and 2 Spanish speaking patients. So, you know, while that comes with 2 different things, I personally, like you can probably guess from this conversation thus far, really have a diverse and international background. So I find that exciting. But at the same time, I have to be honest and say that it's also, you know, definite more time consuming, having to get an interpreter on the phone, you know, making sure that they truly comprehend what you're trying to share and getting an accurate history. So, I mean, it definitely comes with the pros and cons. So I think that, to answer your question directly, I was just surprised at the diversity that I would get so close to where I reside.
Right. And I think a lot of folks, like I live in Hershey, and other people think that Allison Hill, where Hamilton Health Center is located, is just predominantly African American, and that's it. But it's a real, there's quite a diverse community, right? So when it comes to talking to medical students and residents about working in community health, what would you tell them that maybe they either don't know or should understand about what it's like to work in a community health center?
So I think you have to have a lot of empathy. And I know most medical students will say, well, I'm clearly empathetic, otherwise I'd be choosing a different career path.
Right.
But beyond the empathy and the patience that is required in most academic centers. And the reason I say that is because there are so many social determinants of health that are affecting the patients that we serve. So for example, when I worked with UPMC Pinnacle across the Susquehanna River, you know, non-compliance was usually because they just weren't interested in taking the medication, rarely education or other issues. Here at Hamilton, I have to factor in multiple things. Is it the cost of the medicine? Did they truly understand what I said? Are there mental health issues, especially depression during this pandemic, that are limiting their access to care? Is it transportation? Is it the pharmacy being open, you know, for them to go to pick up their medications, you know, when they have multiple kids and they don't have a delivery service? So definitely takes more patience and empathy than I think many other health systems or working at other health systems require. I think also the curiosity to seek more information. So, and generally, like I said, that is what you're trained in medical school, to come up with a broad differential. But the truth of the matter is, when you have 20 minutes for a visit, sometimes we don't think as broadly as we should. Right. You know, and so, for example, yesterday I was in clinic and it was a new patient. She came in for back pain. I could focus on her back pain, but you know, the goal is to focus on the cause and not the symptom. She was morbidly obese. You know, we had a great visit, but you know, it included her crying because of her obesity. It included me realizing that she has a very high likelihood of sleep apnea, which is affecting her fatigue, her ability to work. So basically, I said, thinking outside the box and really, really thinking of your differential and not just treating the symptoms that patients present with.
Gotcha. Right. Very good. So tell us about a day in the life of Dr. Limann. Is there a usual day, or kind of ridiculous question, but what are typical things that happen in your day, and what are some things that can throw you off or cause days to be different?
So the usual is just the general workflow in clinic, so making sure that things are going smoothly. Like I just mentioned, prevention is better than cure, so not waiting until there are fires, but just meeting with each of our office managers, department meetings, etc. And then addressing the various issues or concerns that arise. So you're asking the average day. So again, I can only think for about the past 24 hours, but some of the meetings I've had today pertain to the our operating OR room hours. We have our OBGYNs and our podiatrists use the OR. So reviewing their OR schedule and the efficiency of the time in the OR. Another thing that we were working on today was our emergency plan, which prior to this was focused on the pandemic and was written just based on the flu. Obviously, we have another pandemic, the COVID-19, that we had to add to that. Scheduling concerns, now we have telemedicine, we have a new behavioral health provider that joined us, and so trying to work on telemedicine visits for her. Oh my goodness, trying to think of yesterday in clinic, patient-centered medical home. We are implementing, we're not implementing that, but hiring new staff for that. And then going back to the COVID pandemic, that's really changing every day, as I'm sure everybody's well aware. The vaccine's available, we should be giving it to everybody, but addressing the financial barriers. When I say financial barriers, it's to provide, with the vaccine is free, but the assumption is federally qualified health centers are just going to have the staff available and the plan to offer the vaccine. And so that entails a lot of steps that we're currently taking to try and immunize people in masses. We have been immunizing multiple people since December, but really to reach all of our patients, we really have to ramp up our plan. So like I said, I'm sure there are multiple other things, but those are what I can think of in addition to a full clinic yesterday.
Yeah, right. And so I'm gathering that there is no such thing as a typical day.
Absolutely not. Well, I'll say no. I'll say the typical day, and that's why you answered. One of your first questions was, why did you go into medicine? So my typical clinical days, I know I will see a certain number of patients. I know that I will have complicated patients. I know that I will be making decisions every few minutes. And one of the joys, going back to why I chose medicine, is obviously the patient has to agree with those plans, but 90% of the time they agree with those plans, and we leave with something documented, a follow-up plan, which is very different from administration, policy and so on. So that is part of the day that is definitely the same, and definitely the same in terms of some that are non-compliant.
Right. Very good. Okay, well, thank you so much. Is there anything else you'd like to add before we sign off?
Not really, no, there's one thing I would add is I just didn't, so I mentioned that I didn't realize the severity of the disparities, but working at Hamilton, I've also realized all the ample resources available, which, the multitude of countries I've been to do not have that option. And so, I try to encourage my patients that there is no excuse for them. I know it's easier said than done, but I encourage them to share with me what concerns they have or what things are limiting their access to health, and be that transportation, childcare, food insecurities. I encourage them to discuss and share those. And I was not aware until about 3 years ago of all the resources we have, available to us. And it's important that we encourage our patients to use them.
That's great. That's great. Yeah, it's knowing what we have and how to access it. And that's tricky in our system, but
Yeah.
that it's good you're there to help them do that, and that Hamilton's there and the FQHCs across Pennsylvania, United States are there to help people do that. So thank you very much for your time, and have a great day.
You do the same.
Thank you.
All right.